Pharmacology nursing students, this is a big one, so make sure you save it so you can reference it later. Per a follower request, we're going to go over all TB and HIV medications you need to know for your next exam or the NCLEX. If you have a specific medication or drug class that you want to know, don't be afraid to drop it in the comments. First, let's start with TB medication. These treatments are typically going to last around 6 to 12 months. For TB medications, I want you to remember RIPE, R-I-P-E. Our first medication is rifampin. This medication is going to inhibit RNA synthesis, which means it's going to stop bacteria from multiplying. It does turn body fluids orange, like tears, urine, sweat, but don't freak out. This is actually normal. It is hepatotoxic, so monitor those liver enzymes like ALT and AST. This medication will interfere with oral contraceptives, so tell your patients to use a backup form of birth control. Our next medication is isoniazid. This medication prevents bacterial cell wall synthesis. It will deplete vitamin B6 in the body, which leads to peripheral neuropathy, so your patients will experience things like tingling and numbness. It does have a risk of neurotoxicity, so monitor your patients for dizziness, ataxia, and seizures. This is hepatotoxic as well. Watch for jaundice and dark urine. Our next medication is pyrazinamide. This will disrupt bacterial metabolism. It also increases uric acid, which puts your patients at risk for gout. Also has an element of photosensitivity, so tell your patients to wear sunscreen. This is also hepatotoxic, so check those LFTs. Our next medication is ethambutol. It prevents bacterial cell wall formation. It can cause optic neuritis, lead to vision changes, color blindness, monitor baseline, and encourage patients to have routine eye exams. Big warning here, as you've noticed with all TB medications, they are hepatotoxic. So again, no alcohol for your patients and monitor those liver function tests. Watch for signs and symptoms of jaundice. Let's talk about HIV medications. These are lifelong treatments, but medications can be given to help control the virus. What is the goal of ART therapy? Overall, we want to lower that viral load, increase CD4 count, and prevent transmission. These are the main drug classes that you need to know. First one is nucleoside reverse transcriptase inhibitors. This class is going to stop viruses from making copies of itself. Major side effect here is bone marrow suppression. Watch for anemia. Monitor CBCs for low red blood cells, white blood cells, and platelets. Our second class is NNRTIs, non-nucleoside reverse transcriptase inhibitors. These also stop viral replication. They can cause CNS symptoms, so monitor your patients for vivid dreams, hallucinations, and dizziness. These are not safe during pregnancy. Our third class are protease inhibitors. This medication is going to stop the virus from maturing and spreading. It can cause metabolic issues like hyperlipidemia and insulin resistance. It can also cause lipodystrophy, which is an odd fat redistribution around the body. Typically, you'll see thin arms and legs with a larger belly. Our fourth class is integrase inhibitors. These medications are going to prevent virus from integrating into host DNA. Watch your patients for muscle pain and rhabdomyolysis. If this was helpful, don't forget to save this video and follow along for more Pharm for Nurses.